Hi, my name is Dr. Marina Rubinshtein, and today we'll be answering some questions that we get asked very frequently by patients.
New York City.
Question 1, Dr. Marina. Do e-cigarettes cause staining?
That's a great question because e-cigarettes became very popular. E-cigarettes will not cause staining, but what does happen with e-cigarettes, since it does have nicotine will reduce your ability to produce saliva. The less saliva you have, you're more prone to have a dry mouth. If you have dry mouth, what's going to happen, it's going to cause more bacterial buildup that will lead to cavities and bad breath.
Question number 2, Dr. Marina. What causes dental cavities?
Dental cavities could be caused by a lot of things, but most of it is caused by bacteria. Bacteria takes the food, like sugars, breaks it down and creates acid, and that's the acid that eats away the enamel and that turns into a cavity. So sugary drinks, having a lot of bacteria in your mouth, having a lot of sugar in your mouth, and in addition to acid, will help bacteria develop more cavities in your mouth.
Question number 3, Dr. Marina. Is Diet Coke worse for your teeth than regular Coke?
Diet Coke is not less bad for you because you don't have sugar in it. It's still very acidic, and most of the diet drinks, because of the acidity, will cause just as much damage as regular drinks that do have sugar. So stay away from either regular drinks or diet drinks that will cause the same problems in your mouth.
Question number 4, Dr. Marina. If you don't get braces as a child, is there a chance your teeth will straighten naturally?
The only reason why the teeth will be shifting if there is going to be spacing between the teeth. So if you lose some teeth next to the teeth that are crooked, there is a chance that the other teeth may straighten out, but it usually doesn't happen. Teeth shift throughout life, so sometimes you can have some straightening effect, but they will not naturally straighten out. So if you didn't get braces when you were a kid, there's still a chance for you to get braces when you're an adult. There's a lot of braces, types of braces that's available, and I think you should look into it. There is something called 6-month smiles, which is a short-term braces, which look exactly like regular braces, except it has white brackets and white wires. It works very fast. Most of the aesthetic problems could be corrected from 4 to 8 months, average of 6 months. So don't disregard braces at your age. So go ahead, research it, and go for it.
Question number 5, Dr. Marina. Do regular dental cleanings improve overall health?
That's a great question. Regular dental cleanings does improve overall health because you remove the amount of bacteria in your mouth. That means you reduce the inflammation that goes on through the body. The less inflammation you have, the less your immune system has to fight it, so you can be fighting other things that are more important. The less bacteria you have, the less inflammation that's going on in your body, the healthier it is for the body. The other thing is, if you have a lot of inflammation in your mouth, that will increase your chances of developing heart disease, stroke, diabetes, and even if you're pregnant, that's another major thing to make sure your mouth is absolutely healthy. because there is a tendency of having a low-term birth or a cut short pregnancy and getting problems with the baby preterm. So I do recommend having regular dental visits and cleanings on a regular basis. Follow your hygienist instructions, and that's going to keep you healthy. Thanks for tuning in, and please, if you have any questions, send it to us. We'll be happy to answer them on the next episode. And remember, a beautiful, healthy smile is your path to a brighter future.
New York City.
To get your questions answered on the show, comment below or use the hashtag AskDDS, AskDDS.